Yes, you are listening to Dan Bongino Show, and it is an absolute pleasure to welcome back to the show a very intelligent man. Had a fascinating interview with him last time, Dr. Stephen Quay. Doctor, welcome back to the show. Thanks for taking the time.
No problem, Dan. Happy New Year.
Happy New Year to you as well, sir. So last time we spoke to you, it was a troubling interview. I don't mean because your content was terrific, but it was some disturbing things. We were talking about some gain-of-function research, the Wuhan lab, and some evidence you had indicated that there was some gain-of-function research potentially going on other viruses over there, one including the Nipah virus, which has a far higher lethality rate than the original coronavirus and any variant thereafter. Any updates on that since we last spoke? I'm intently interested in this, and I have to tell you, Doctor, of all the interviews you've done on this show, that interview with you about the Nipah virus, I got hundreds of emails about that. People are really scared, I think justifiably so.
Yeah, I agree, Dan. And no, there's nothing new. We completed our investigation. We sort of closed the book on it. But in December 2019, the Wuhan Institute of Virology was moving the genes of the Nipah virus around with what are called vectors, which are standard biotech. They're basically building a new Nipah virus with pieces and the biotech tools that you use, which are called vectors. It's probably where SARS-CoV-2 was in about 2017, 2018.
Oh, my gosh. We're talking to Dr. Stephen Quay, an expert in this field. That's really frightening stuff. We had interviewed you on my Fox program as well. And like I said, I got a lot of feedback. So, yeah, if you hear anything on that, Doc, please let us know first. Jim, get like a bat phone in the doctor's office so we can hear first, please. All right, moving on to a different topic. Doctor, Omicron. It appears from the early data, and I understand science evolves all the time. I actually believe in the scientific method. But it appears from the early data that Omicron may be less lethal, although probably as contagious, if not more. Those variables aren't necessarily correlated one-to-one there. Is there a silver lining here in that you can catch this virus now? You may have a lesser chance of dying than, say, other more lethal variants, and you'll develop a sense of natural immunity. And can that possibly be the first kind of breach into some sense of herd immunity where we can finally just start to live with this thing and not panic about every new variant?
Dan, if you want a career in science, call me up, because that's exactly the summary of this particular virus. It's amazingly infectious. So it is now the number one virus in terms of the number of people you can infect. Measles used to be the number one with about 10 people per infected person. But I call it the sneeze heard around the world, because it is so contagious that you can literally fill a room with a sneeze of it and infect everybody. There's a restaurant in Norway where I believe one person dined before Christmas, and there were 170 cases from that one person in a Christmas party going on there. But the absolute also good news is this virus really likes to live in the nose, the back of the throat, and it goes about 4 times faster than Delta in that space. It does not like the deep lungs, where pneumonia, where it gets into your bloodstream, where the real bad acting is. So it is absolutely a silver lining. I think that this probably everyone may get this, given where we are in terms of it being winter. You're indoors a little more, and it is so infectious.
We're talking to Dr. Stephen Quay, a brilliant guy, always a welcome guest on the show. So, Doctor, from your medical perspective, it seems fairly obvious that if you were given a preference, you don't want either, but to have an infection that's upper respiratory in the nasal passageways, and in the sinuses or the lungs, you clearly want something in the nose, kind of like a cold. You get the runny nose, you rub your nose, you get sinus infections. But it was what you're saying, when it penetrates into the deep lung tissue, this is where we start developing the severe complications, the respiratory stuff, the inflammation, and potentially, sadly, death. Is that accurate?
Yeah, that's exactly accurate. But we now know that Omicron doesn't do very well in that space. So,
why is that? If you don't mind me asking, sorry to interrupt, but why is that? Why is it that Omicron, in contrast to Delta and the original Alpha variant, doesn't do as well? Thankfully, in the lungs. What is it? Is it ACE receptors? What exactly is that?
We don't know. That is a cutting edge question to ask. There's a gradient with more ACE2s in the upper airways and fewer down in the lower airways. So it may be related to that natural gradient, but the data you have doesn't jump out and say that's the reason. We have the observation it's 4 times faster than Delta in the nose, about 1/10 as fast in the deep lungs. Not quite ready for a mechanism yet. But that's where science is, right on that edge.
Right. We're talking to Dr. Stephen Quay. Doctor, this phenomenon's been seen before with respiratory pathogens. I mean, this isn't a new thing where a virus evolves. I hate the term learn. It doesn't learn anything. It's not alive, technically. It's like a protein code, right, and some genetic material. But it evolves to become more contagious but less infectious. And I think the reason is fairly obvious if you know just the basic science of evolution. I mean, you don't want to kill off all your hosts. It's fairly obvious. So we've seen this before in the 1918 Spanish flu, and even some viruses in the past that were respiratories that evolved into basically what we have now being common colds. So this isn't the first time this has happened. And, but having said that, are there examples of respiratory viruses that you know of that have become not only more infectious, but more dangerous? And are you worried that this Omicron could turn the corner into something more devastating later?
The answer is it's possible, but I think it's very unlikely.
Good.
And part of my answer comes from the fact that we've done one of the largest gain-of-function serial passage experiments in the history of the world, right? With 400 million recorded people with COVID, and probably 1 billion, who we don't really know. We didn't diagnose them. So this virus has had 1 billion chances to get as bad as it can, and we are where we are, which is actually a really good spot with Omicron.
Yeah, that's a good point. It's not like it hasn't had the chance to replicate. Sadly, that's correct.
Yeah, well, and Delta came out. The Delta did go through that period where it was more infectious and about as lethal, or maybe slightly more lethal.
Yeah, I didn't have mine broken down, but I'm pretty sure I had the Delta when I got it. And I can tell you, even being vaccinated, Doc, it was no party. I mean, I've had serious cases of the flu. I contracted dengue fever in Panama, and I can tell you, I mean, dengue fever, they call it breakbone fever, and believe me, it earns its title. And I got to tell you that my bout with coronavirus, even with a vaccine, was worse than that. I mean, it was a horrible night. Thankfully, we had the monoclonal antibodies here in Florida. Doc, long COVID. Yep. This has been long, no pun intended, long a talking point by people. This idea that if you get COVID, that you will have symptoms that will go on for a very long period of time, called long COVID in the media. Is this a thing? Is this more of a psychosomatic thing, or is this a real biological phenomenon, long COVID?
Yeah, it's complicated, Dan, and I've had to look at it as lots of different ways. One of the things that we have to keep remembering is we've never looked at a viral infection like we have with COVID. So the scientific energy and horsepower put on this virus is higher than we've ever seen before. It's very possible that any sort of influenza, any other kind of virus that can put you in bed for a week, probably 6 months later you're still not back to where you were the month before the infection. So I'm worried, but I'm not seeing anything that's totally remarkable. Now, both the vaccines and the virus change your coagulation. So if I had any tips that I'd want to give to people, we know that simple hydration can give you a 10 or 20% improvement in your risk of getting a stroke after you've already had a stroke in the year after that. So people that drink 100 ounces of water a day versus those that don't have a 20% reduction in a second stroke. So, staying hydrated is going to be I think it's just really important. We have so many people infected that when you see something that's 1 in 100,000 or 1 in 500,000, in the United States, you're going to have, thousands of people that have something at that level. So I'm a little worried about it, but I'm not seeing something that I can't. What I'm looking for is a mechanism. What would be a mechanism that would give you long COVID? The only thing I can hang on my hat on is I think your blood is a little thicker, a little clots a little more easily in those weeks and months after either an infection or the vaccine as well.
You know, it's incredible, Doc. We're talking to Dr. Stephen Quay, how just simple medical advice, you'd give to kids, even in a serious situation like COVID applies. Wash your hands, eat your fruits and vegetables, stay hydrated, get adequate intake of vitamins and minerals to a healthy diet. I mean, exercise. I'm not suggesting that's a cure for any disease. When you get it. But it's amazing how, that can act in such a prophylactic manner to keep all these long problems away from you. I'm glad you brought that up. I've got a limited time left, about 2 minutes. I'd like to squeeze in a couple more questions. Doc, what in your professional opinion do you think went wrong with these mRNA vaccines? I mean, listen, I'm not here to get into hysteria or anything like that. It's not a pro-anti-vax debate or anything like that, but clearly it did not meet the initial hype. When I first got the vaccine after my battle with lymphoma, they said, upwards of 90+% effective. That didn't pan out. What do you think went wrong?
I'm working on that, and I have a paper that's coming out. I think it's appropriate because I've talked about it a little bit in public before. Is one of the things this virus does is release proteins into your bloodstream that suppress your immune system, that make it asymptomatic, and that make the immune system not very good, a little bit like HIV. And those proteins are not in the vaccines. So you're vaccinating against the spike, but you're not vaccinating against a protein which is called ORF8. You take a person who's had COVID and you look at where their antibodies, what does the body see with a COVID patient that it doesn't like? The highest level of antibodies are against ORF8, not against the spike. So we probably should have included ORF8 in the vaccine. I mean, we've never had a coronavirus do this. So why does this coronavirus make a protein that it spills into your blood ahead of time before it even makes baby viruses that can suppress your immune system? That's a pretty intriguing question.
Wow. You caught my attention. My producer was getting ready to take a bite of his sandwich, and he put it down, Doc, to hear your answer on that one. And believe me, no one gets between him and a Jimmy John's gargantuan. So you really got his attention there. Well, last question. I got about a minute left. Doc, it's more. I'm asking you to make predictions, which is kind of silly, but you are a professional, and just your best guess. Natural immunity. We obviously don't know how long it's going to last because our time horizon is only about 2 years. The virus has only been with us that long. But your best guess on what you've seen so far, do you think it's going to be long lasting? And if you do, are we talking 5 years, 10 years? Are we talking a lifetime? Limited immunity over a lifetime? Your guess on where this is going to go.
I think that we're going to end up with quite good immunity against it. And the interesting thing that we don't talk about is we measure antibodies and we say you need a new vaccine because your antibodies are going down. Every vaccine you get, your antibodies go down. What doesn't happen is your memory B cells, they've been to Fallujah and they've been fighting, and now they're on R&R, but they're ready to go back into action. And those are a lifetime. Memory B cells and T cells are lifetime, special warriors against coronaviruses. So my 60% probability, 55. So don't bet the store on it. Is that this is going to become endemic? It's going to be like influenza. It's going to have good years and bad years. We'll be back to having 60,000 people die a year, or 120 with influenza, which we've had. We don't shut down. We don't stop the world for that. It's really bad for people who get that. But that's where I think we're going to end up.
Well, that's semi-good news. Dr. Stephen Quay, always an honor to have you on the show, sir. Thank you very much for your time. You're welcome back anytime. Much appreciated.